all in lamb or ham. Doesn't get any better than that. Here's what we're saying, beloved. We are saying that benzos are the easiest drug on the test if you just remember the endings. The problem is you just have to get better and better every year, I might add, at learning generic names of any drugs, okay? But especially the benzos. Raise your hand if you remember RaDonda Vaught and the lady who killed the patient because she gave them a fucking paralyzing drug called vecuronium. Raise your hand if that's kind of familiar, and she was going to go to jail for it. Y'all remember that? Okay, for those of you who don't remember, the drug that was ordered was literally a benzodiazepine. The type of benzodiazepine, and yes, you should highlight benzodiazepine under that drug name. The type of benzodiazepine that was ordered was called out by the doctor in a brand name. So a while ago, someone said to me, well, Shelly, I figured out that I should just learn all generic names. Like, fuck the brand, that doesn't help us. Bullshit. No, you're going to learn both. It's hard, but you got to learn both for a lot of these drugs because your patient, they only know brand names. Old doctors, they only use brand names. I will never forget it. This was 3 months ago, and I was in the room with one of my favorite docs. He's probably in his early 60s. And whenever we give sedation, we have to write the drug name on the board and put the dose that we've given. It's a dry erase board, very small like this. So I wrote diphenhydramine, midazolam, blah, 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 and whatever dose I gave. And he was like, what the fuck is that? I said, see, you want some bullshit today? I said, you know what that is. No, the fuck I don't use them names. What the hell? I said, it's Benadryl. Oh, yeah, that is Benadryl. And that's Versed. He was like, man, you bougie. So your doctors don't even know these names. They be like Versed. That's what they think and stick with their whole day. Versed, give her 2 of Versed, give her 3 of Versed, give her 4 of Versed, give her 1 of Versed, 1 more Versed. Blah. They don't even know. Unfortunately for you, I haven't met a doctor put in jail for not knowing a drug name. But this nurse almost went to jail for not knowing a drug name. So understand how this whole thing developed. Was RaDonda Vaught a new grad? Yes or no? Hell no. How long has she been a nurse?
3 years.
3 years. Her normal floor was a neuro unit. Her 73-year-old patient that day was ordered a scan, a nuclear scan. Probably a PET, but I'm not sure. PET scan or something like that. Some kind of nuclear shit. At any rate, she took her 73-year-old patient down to radiology to get the scan. When she got down to radiology, the patient was very nervous, anxious, maybe claustrophobic. And the doctor said, okay, well, we're going to go ahead and get you 2 of Versed. RaDonda Vaught went to the Pyxis machine. She put in Versed and got nothing because your Pyxis machine, my Pyxis machine, is all generic. So she thought she'd misspelled the drug. So she decided, since that didn't go over too well, I'll just put the first 2 letters and see what it pulls up. She got vecuronium, which is a paralytic agent that works from the head down to make you completely paralyzed so you don't pull out your trach or extubate yourself in the units. What else is this drug used for? Fucking capital punishment. Oh, gosh. Yeah. That was her first problem. And I bring that up because I need y'all to know her first problem started with not knowing generic name for this benzodiazepine. She had no idea. Now let's see if you do. What's the generic name? It's okay if you don't know. Just say, I don't know. For Versed.
Oh, I don't know.
What's the generic name? What's the generic name? What's the generic name?
I don't know.
What do you think?
Benzo?
No. So in my class, we're 0 for 0. So, but you haven't been a nurse 3 years with an order to give this. Prayerfully, your punk ass would look it up. She didn't. She did not look it up. What did she do instead? She put VE, hoping she had misspelled it and it would just come right on up. Okay, let's say that was you. Let's say that you went all the way down Dummy Dumb Street and you didn't know the name, which is fine because we don't know the names of every drug. There's no way you could. But you looked it up. Then you would have found the generic name ends in Lam or Pam. In this case, midazolam. Now, I've got it in a bunch of these packets because I know this story like I know my name. And I've taught it way before this happened because this just happened a couple years ago. Now, let's just go a little step further. Let's say that you did do what you did. I know that none of my babies would have killed that patient. Here's how I know it. Even though you don't know what the other name for this drug was, I know you know this. A nurse of 3 years knows if the doctor orders a drug and he tells you to give it IV push, how do you give this?
Over 3. I'm not sure 3.
Slowly, right? So 2 to 6 minutes. So that's why you remembered the 3. In other words, you know IV push needs to be given slowly. Oh no. See, what happened was when she gave this patient this drug, she just went like this. If she had did it over the 2 to 6 minutes, she would have been like me, looking at the clock as you give it, and she would have noticed the patient coding before she even finished giving it. It don't take long for this motherfucker to kill you. Okay? It don't take long at all. So while you are pushing it slowly, she's coding. And you would have been able to catch it. But here's how bad this got. She did like this. They pushed her in the scan. Nobody could see her dying from the head down. This nurse went up to her unit. She actually says in the courtroom that I watched every minute of the case, she said in the courtroom out loud for somebody to hear that when I got to the top of the stairs of where my unit is, I heard the code called in radiology. She heard that code called. Here's how ugly this is, guys. When the patient coded, the doctors were ordering the antidote for Versed.
Oh,
What is that? Flumazenil. That only made matters worse. Because the antidote for this is damn sure not flumazenil. So now they're wasting time. So what I'm trying to tell you is somewhere along the way, you would have been able to capture your mistake if you had just kept to your basic nursing principles, which is that all IV push meds are given slowly over 2 to 6 minutes. Because guess what, y'all? Had they known that this lady was starting to have that reaction, they would have been like, well, what did you give her? How much? Let me see the vial. And they would have said, oh, shit. Let's get the antidote. That was vacuronium. They could have saved that lady. It gets worse. Yes, I'm giving you guys a hard time in terms of nurses in this scenario, but the doctors were a piece of shit as well. Here's what happened. They never reported the death.
what?
They said natural causes and lied on the death certificate. It was found out a year later by an anonymous tipster.
What?
Only then did they go after this nurse. She had been working there just fine after this mistake. No one ever told. Nothing was ever relayed. And here, get this. The anonymous person gave a tipster to the county because it's a Medicare patient. And it turned out that the hospital had worked out a down low, what do you call that? Settlement with the fucking family.
Oh.
This was at Vanderbilt in Tennessee, a big, well-known hospital.
Well, why she go to court then? If they paid them
Undercover
all?
settlement, baby.
But why she go to court then if they paid the family off?
Because it hit the news.
And because Medicaid.
It hit the news. 1 year later, she starts losing her license, going to court. This happened a whole year back. But they didn't do anything then except what we typically do, which is, okay, what happened? How did it happen? Oh my God, from now on, don't do that because it's human to err. But they wanted to use her as a fucking human guinea pig and as an example. And let me just help you in case you're confused. If she was brown or black, she'd still be in the motherfucking prison.
Yeah.
But she wasn't. She was lily white. And so when you're lily white, the entire country took up a collection for you. All your bills were paid with every lawyer you ever had by the GoFundMe account that was on Facebook for her. But your little ass, oh no, I got to keep your ass out of jail right now. Because that ain't going to be you, boo. Let me help you with this.
You're a threat.
You are a threat.
Oh, yes.
Okay, DEI. Okay.
Yes.
Now, that part. Okay. Now, so there you go, guys. I need you to kind of take me serious. I mean, I bullshit a lot, but I need my precious babies to take me serious when I say just kind of, get familiar with these drugs. Don't be so quick to give something you don't know. I can honestly tell you, because I don't just talk this shit, I do this shit. I can tell you that I have a list in my phone when I work, because from time to time I'm working and I'm like, what the fuck is that drug? Okay? And you're not alone. I mean, you don't come to this world knowing this shit. So, here we go. I got on this thing, it says new meds, which means I don't fucking know what this is. New meds. One of my new meds one day was, oh, no, my phone. I can't find that damn drug now. So keep a list, if you can, in your phone of the different medications that you're like, what the fuck is this? And don't you dare give it if the patient is looking crazy and cross-eyed. One of the things that was on the test recently is if the patient says, Oh, I ain't never took that. Don't give it to him. Don't give it to him. Because probably it is a mistake. You feel me? Don't give stuff patients say, I ain't never took that. If they looking crazy, you should too. I can't find the damn drug. Wait a minute, I'll find it. Because it was something you guys got to know. Yes, it's this one. So this drug was in my unit, and the patient says, I'm on that Voqueezy stuff. What the fuck? I said, who? They said Voqueezy. It's Voquezna, and it is basically like a PPI, okay? But it's more effective than a PPI. And then I want to give you the actual brand name, a generic name, because that was the brand name, because I'm like, what? And I looked the damn thing up because I'm like, I don't know what you on, shit. And I ain't trying to guess. Now I see the drug every other day. So it's really popular now. Let me give you the generic name, and it has been on the test. The generic name for Voquezna, and it's just like a PPI used for the same exact reason, is Vonoprazan. Vonoprazan. The fuck? Okay. That's the generic. You got to know that for the test. The test is all generic. But, you know, I'm, 60 years old? I'm still looking shit up, okay? Don't feel bad if you got to look shit up. Don't even feel bad. Drugs come out every day, y'all. Okay. Now, let's repeat. You got your lithium filled out. You got your benztropine done. You got your Haldol completed. Chlorpromazine. What's the next drug in your packet? Because it's different in mine. Oh, good. MAOIs are done. Tricyclic. Huh? Clonazepam. Okay, so we're finishing that. Your SSRIs are done. Your Wellbutrin is done. Okay, now, so the only one left, and I really want you to know this is covered so well in your medication categories, but I want to give you the highlights. Number one that I find you guys don't realize, this is addictive. Your benzos are addictive. A lot of people take them, but they're addicts. So they are addictive. They should not be long-term. So find your clonazepam and put on there addictive. Should never be long-term. They are deadly if you abruptly stop them, just like withdrawal from opioids. So clonazepam, that's what you're looking for in your packet, and put in your notes, deadly with abrupt withdrawal, just like alcohol withdrawal. Just like alcohol withdrawal or opioid withdrawal, the withdrawal from this is deadly as well. That's why we are not trying to have you hooked on this shit. So when we look at alcohol withdrawal or DTs, the next substance that kills you, the same way, by the way, is this one, benzos. So if a patient is addicted to these, they cannot even be stopped. They're gonna have to be weaned down, or they can die easily. This is a very dangerous drug category to be addicted to. And there are plenty of people addicted to them.
Yeah, I know too.
Oh yeah. Yep, and they're in every song. Every stupid rap song talks about them. So ridiculous. Okay? Now, so one of the things you got to remember when you give a patient this medication is typically is for procedures. It is legitimately given by all of us for procedures. I use it all day. I give a shit ton of these drugs all day. So it's for sedation. You got to remember, no driving. We tell you no work, no school, no driving, no operating heavy machinery, and don't even think you're going to go somewhere and make a legal decision because you're under the influence. So that driving is a big deal on your test. No driving. Obviously, if these are going to be used for the panic attack patient or the procedural patient or the detox patient, they are IV push. If we do give the pill version out, it should be at night because they make you drowsy. The last thing I want you to remember is what it says on the paper itself. You cannot just remember it's a benzodiazepine. You got to remember it's an anticonvulsant. So it's great for seizures. Now, the biggest thing on the test, believe it or not, is the antidote for this medication category. And so let's get ready to do that. Flumazenil. Flumazenil is the antidote. Don't let me hear you on this test talking about some damn Narcan. One of our problems with why patients that are overdosing died is because you kept on giving them Narcan when actually their drug of choice at that time was benzos. And the Narcan reversed the actual opioid, which could have been heroin or whatever, but it didn't do shit for all that Xanax they took. It ain't did nothing for all that Ativan they took by a handful. So you got to remember that many patients who require naloxone, which is Narcan, should also receive flumazenil if there is no improvement after repeat dosages. Don't just keep fucking going up on the Narcan. I've seen people give 10 Narcan and ain't gave not one flumazenil yet. I mean, just keep hitting the patient with Narcan. Like, did y'all try flumazenil? Flumazenil, IV push. Yeah, all this shit is IV push because it's an emergency. Naloxone you can put in your nose, okay, but not no damn flumazenil. So what I'm saying to you, and I have had to be the nurse to say the annoying thing, because that's me, annoying. So I will be in the room and I will say, hey, y'all get that flumazenil yet? It's sitting over there on the counter. Oh yeah, let's try that, y'all. She ain't coming too, let's try that. Because again, you don't want to assume it's always fentanyl, heroin, morphine. No, remember, there's a lot of people like Xanax and Ativan out here. Okay? All right, guys. Now, that's that for your psych meds.